Today I want to talk about how coronavirus is affecting people in places and how there might be a disproportionate effect felt by certain people and places compared to other places. Madonna said this quote that coronavirus was the great equalizer. She said it on Instagram while sat in a bath, and she was saying that because the virus had affected rich and poor, it affected heads of state, but it also affected, your average bin man, that the virus put us all in the same basket, that it was unassuming in who it picked, and therefore anyone could die from it. And people got quite frustrated about this. And it's not because to say that some of the elements weren't true, but the fact is the virus, while it can affect anyone, the way in which it affects people is very, very, very different. And I'm going to talk a little bit about how the disease has actually exacerbated current fractures of social inequality in various places across the world. The first thing to recognise is that the coronavirus has a huge spatial variation. So we can see here that on the east coast of America, the New York area has a huge concentration, so 242,000 cases there, and 17,000 deaths so far as of the 19th of April. And we've also got kind of large clusters in Miami, Chicago, Detroit, down here New Orleans even. So we can see that there is a urban and rural spatial variation. This is obvious because it's an infectious, contagious disease, and therefore it spreads easily when there are a lot more people around. And so if we look in the areas over here in Montana and Wyoming, we have much, much lower concentrations because the population densities in these states is smaller. So even on a geographical sense, we have a huge spatial variation. So the geographic spatial variation on a national level in America is relatively straightforward and kind of obvious. What's more worrying is the fact is when you look at on a kind of a more localized level, it is often the people that are the poorest that are disproportionately affected at the moment. So if we look at this poverty map of New York City and the confirmed coronavirus cases in New York City, we can see a pattern. So if I'm looking up here in the Bronx, we have a kind of 600 to 800 cases, and this is in an area where we have got 50% of 80% people living below the federal poverty level. There are other kind of similar trends in other areas. So if we look at Williamsburg down here, we can see that higher amount of cases, again, another area that is in that dark blue kind of high poverty level. Also, if we just look at across Brooklyn, just south of Williamsburg, this area here, generally lots more blue, lots more poverty, and here it has got more cases. Elmhurst and actually a place called Corona. Again, this is in this area here where we have slightly higher poverty levels. And equally oppositely, where we have areas of lots of green with low poverty levels, we see much lower cases. So in Queens and Manhattan, generally areas that have lower poverty levels, we have a lot less cases. And there is kind of reasons behind this, but we need to be very clear that often in citywide levels, we are getting the poorest people are the people that are contracting the coronavirus. And I'll go on to explain a little bit why there might be an indication of this. This obviously in a place like New York has a racial element. So in the Bronx, we have a large, Hispanic community, and therefore this is not just affecting kind of the poorest people, but it's affecting certain ethnic minorities. And this is the thing about coronavirus, whether we look at New York or we look at London, we will have certain groups that will be disproportionately affected, and it can be along the lines of both class, poverty and race. So we've seen this pattern where communities that are poorer and often ethnic minority communities in places like New York are disproportionately affected by coronavirus. We can see this in statistics that New York has put out, in where the Black and Hispanic community, which makes up, or in terms of New York City, makes up about 51% of the population. Unfortunately, it is now accounting for about 62% of all the deaths related to coronavirus. Meanwhile, if you look at this and compare it to the white population, the white population counts for 32% of the population, but is only accounting for about 27% of deaths. So there is, we can say that within the stats there is some kind of evidence to suggest that the Black and Hispanic community are being affected slightly more. And we've got to kind of look and ponder why this is happening. So one of the reasons that the Hispanic and Black community are affected slightly more is that a lot of them will be what we call essential workforce. So they will be in jobs that are offering in lots of access to the public, and they will be doing jobs like delivery drivers. They will be working in the transit system. But also, if you look outside of New York, they will be working in kind of agriculture. So jobs that they have to do in the actual place of work, they can't do from home, and therefore they are, have a higher exposure rate in terms of to the actual virus, because especially in these populated areas, they are still encountering lots of people, even though people are being told to stay at home. So they have a higher exposure rate. Lots of these jobs that they're doing are unfortunately very low paid, and therefore they don't have the financial safety net, and so they can't just take time off work. So they are essentially forced to work, otherwise they can't pay their rent and pay their bills. And if they have, 4 weeks off, they won't be able to pay for food and basic services. Where if we look at certain people, you look at it like a marketing executive or someone working in advertising, they can just stay at home and do their job and still get paid. And therefore they are financially protected from the kind of economic costs of this. A lot of these jobs, essential workforce and the Hispanic and Black community won't have the same access to healthcare, especially in a place like America, where you're having to pay for healthcare. They won't be able to afford healthcare. A lot of these low-paid jobs won't offer healthcare as a benefit, and therefore they are, unlikely to get the same kind of medical attention that other groups in New York, richer groups who can offer pay for their own healthcare, but also pay for private healthcare if they're lucky enough. And there is also the Trump factor. So Trump has obviously done a lot in terms of kind of anti-immigration. So very much targeted at the Hispanic community and trying to get them to avoid accessing healthcare. And therefore, the Hispanic community does have a lot of undocumented migrants from Mexico, and therefore they are wary about accessing any kind of healthcare, because they will then potentially come in contact with immigration officers, which might mean that they don't have access to the healthcare, and then they could be deported. And so they are kind of refusing to access healthcare. So where Madonna is saying that coronavirus is the great equaler, for some people this has exacerbated the kind of already tough conditions that they've already been in and worsened their conditions. And this is just in the short term. If we look in the long term, people that are having to go into these jobs and potentially might have more medical bills, therefore that was a long-term issue where they would be having to pay for kind of increased medical costs in the future. But there are people that might have lost a job, and therefore they don't have the financial backup to be able to support themselves, and so we're going to get these kind of problems exacerbate, and cycles of deprivation and poverty will continue. The last point to mention is that these people that are undocumented in the Hispanic community won't have access to employment benefits, and therefore, while people that are becoming unemployed can access those government and federal reserves, these people will be wary of doing that again and again, sliding more into poverty, which obviously does not protect them from the potential costs and difficulties associated with coronavirus.